10 kidney failure signs and symptoms people often miss. About 45 million Americans have kidney disease, and 90% of them have no idea they have it. This is terrible news because, as we all know, early prevention is key when battling diseases and illnesses. But not to worry. In today's video, we'll be showing you 10 of the most telltale signs of kidney failure that 90% of people who have kidney failure do not know about. What does dry skin say about your kidney's health? How about your appetite? What color of pee is healthy, and what color should you be concerned about? Sit tight as we'll discuss all these things and more in today's video. Number 10. Muscle aches. The kidneys regulate electrolytes in your body. These include minerals like potassium, sodium, and calcium, and all these minerals play vital roles in muscle functions. For instance, potassium controls how your muscles contract and react. So when potassium levels are too high or too low, this could mean that your kidneys are not functioning properly. Signs of potassium deficiency in your muscles include muscle aches and heart palpitations. In extreme situations where potassium levels are too high, it could result in life-threatening conditions. So you definitely want to pay a visit to the doctor if you notice unexplainable muscle aches. Number 9. Dry, itchy skin. The kidneys are responsible for getting rid of toxins in the body. If the kidneys fail, these toxins are left to pile up, and that's what causes dryness and itchy skin. Itchy skin can also be caused by an imbalance of hormones in the bloodstream. For instance, when there are excessive levels of phosphorus within the body, some of the phosphorus gets retained in soft tissues of the body, and this can also cause itching. It's difficult to tell if the reason for the itchy skin is kidney failure, as there can be a multitude of reasons why you could develop itchy skin. So your best bet would be to see your doctor to at least be able to rule it out. Number 8. Stinky breath. Bad oral hygiene will always result in bad breath, but kidney failure could also be a reason for bad health. If you sense a distinct, ammonia-like, metallic smell in your mouth, then you just might have a buildup of waste products within your body which your kidneys are struggling to get rid of. These wastes will increase the toxins within your body, which is very dangerous. In fact, toxins produced from kidney failure can affect the brain, causing nausea and vomiting. So if you notice any bad breath from your mouth and you're sure it's not due to poor oral hygiene, then you should see your doctor right away. Number 7. Tremors and shaking. One of the obvious consequences of kidney failure is a buildup of toxins in your body. And like we've already pointed out, these toxins could have adverse effects all over your body. For instance, toxins can be poisonous to the nerves in your body, and this could lead to tremors, or what people call the shakes. When these tremors become more serious, they affect the way you walk, causing you to have abnormal gait. Those who suffer from these kinds of tremors will find themselves falling over more frequently as well. Number 6. Loss of appetite or decreased appetite. As toxins continue to increase in your body due to kidney failure, they might cause any food you take to leave a bad taste in your mouth. This can quickly make you lose your appetite because, of course, you wouldn't want to eat that food that doesn't taste good. If left unattended for a long time, loss of appetite can also lead to weight loss. So if you notice an unintended weight loss which is accompanied by a terrible sense of taste, speak to a doctor immediately. You just might have kidney failure. Number 5. Shortness of breath. When the kidneys start to fail, they find it difficult to remove excess fluid from your body. This leaves excess fluid in your lungs, which can cause pressure and pain in the chest area. This buildup of fluid in the lungs often leads to shortness of breath. But the pain in the chest will be accompanied by episodes where you'll find yourself gasping for air, especially after doing some physical activity. It is important that you see a doctor immediately if you feel any tightness in your chest accompanied by shortness of breath. Number 4. Change in the color of your pee. Sighting blood in your urine is an ominous sign that requires immediate medical attention. Many things could be responsible for it, and one of those things could be kidney failure. So you'll want to check that out early enough. You should also look for any changes in the color of your urine. When you're dehydrated, the color of your pee will be deep yellow, and that's perfectly normal. However, if you notice any other abnormal color changes, then that's a red flag. Also, if your urine is bubbly or foamy, that is not a good sign. Bubbly urine is indicative of the presence of protein in your urine, and this is not normal. The kidneys should never allow the protein to leak into your urine. When this happens, it's a clear sign of kidney failure. You should also pay attention to the frequency of your pee times and the ease or difficulty with which you pee. If you notice that you're waking up more often at night to visit the loo, then it could be a sign that your kidneys are failing. There could be other reasons why you're urinating more frequently though. It could be due to diabetes, urinary tract infection, or an enlarged prostate. You'll never really know the cause of your frequent urination until you go for a medical checkup. Also, if you feel some sort of difficulty or pressure when you urinate, that's something you'll want to address at the doctor's too. Number 3. Insomnia. When the kidneys fail and toxins continue to build up in your body, these toxins could find their way to the brain where they begin to affect your sleep patterns and the quality of your sleep. If you find that it's becoming more difficult for you to fall asleep for no apparent reason, then you could have a kidney failure issue. People who suffer from sleep-related issues due to kidney failure will typically find it difficult to fall asleep both at night and in the day. If this happens to you, you should definitely see a medical personnel. Kidney failure could also cause sleep disorders like sleep apnea, even with patients who are not overweight. Sleep apnea is a potentially serious sleeping condition where a person's breathing is punctuated at intervals while they sleep. Kidney failure could also result in anemia, which in turn could lead to restless leg syndrome. This is a condition that causes spastic leg movements at night, and when it happens, it could cause night interruptions and adversely affect the quality of your sleep. If you suffer from any of these symptoms, you should see a doctor to rule out kidney failure. Number 2. Fatigue. One of the key functions of your kidneys is to create red blood cells. So when the kidneys begin to fail, red blood cells aren't produced in their required quantity, and this is the major cause of anemia. So how does this affect fatigue? Well, to understand the relationship between the production of red blood cells and fatigue, you have to closely consider the functions of the red blood cells. Red blood cells help to move oxygen to various parts of your body. When these red blood cells are not enough in the body, key organs and muscle groups in your body will be starved of oxygen. This is what causes fatigue. With this kind of fatigue, you'll realize that you're feeling tired for no apparent reason. For instance, you could wake up from a night's sleep and feel like you never slept at all. Whenever you feel this kind of tiredness, it's always best to see a doctor. Number 1. Swelling in the body. The key function of the kidneys is to remove excess fluid from the body. The kidneys also regulate sodium levels in the blood. As the kidneys start to fail, their ability to remove sodium from the blood begins to wane. This means that your body will not get rid of excess salts, and that can become a big problem. If you're familiar with a process called osmosis, then you'll know that fluids containing water tend to accumulate in regions with high levels of salt. So the presence of excess sodium in your body will make your body retain a lot more water, which will cause swelling all around your body. You'll notice swelling in your hands, face, around your eyes, and more especially in your feet. Now, several things could cause swellings in these areas of the body. These include diabetes, liver failure, heart failure, and damage to leg veins. Swelling could also be a side effect of certain medications you might be taking. It's impossible to tell just by mere observation what the cause of the swelling could be. To ascertain the exact cause of these swellings, you'll need to see a doctor. Other symptoms of kidney failure include memory loss, high blood pressure, loss of concentration, and dizziness. But like we said earlier, 90% of people who have kidney disease are completely unaware that they have it. And one of the reasons for this is that they have no symptoms. Yes, early on when the kidneys start to fail, there are often no symptoms to let you know that you have a kidney issue. This is why carrying out routine medical checkups is very important. You can also ask to be screened for kidney disease. When kidney disease is diagnosed very early, it becomes less complicated to treat. You can also ask the doctor to let you know what your risk factors are so that you can steer clear of kidney disease. Comment down below your thoughts, give this a like, share with your friends, and don't forget to hit the subscribe button and notification bell to keep you updated for more interesting facts, tips, and ideas from SmartVille.